Hi, my name is William Shoemaker, and I will be doing a group presentation on Dale Morse and eradicating measles. This presentation was originally presented by Richard Gasparoni, myself, Patrick Dusage, and Caprione Boyd, but the original file was corrupted, so I am doing revision by myself. What is measles? Measles is an acute viral illness that is highly contagious. The vaccine was introduced in 1963. Before that, and even after, measles was highly contagious by direct contact and by breathing it in. It is known to be one of the most contagious diseases. Symptoms include fevers as high as 105 degrees Fahrenheit, cold-like symptoms, swollen eyes, small gray white spots in mouth, aches, pains, loss of appetite, tiredness, and lack of energy. So general fatigue. Other symptoms include malaise, which is weakness, coryza, conjunctivitis, which is a thickening of the eye lenses. Also results in maculopapular rash. So I can see right here in this bulletin, symptoms include hypertemperature, runny noses, cough, sneezing, red watery eyes, white spots, red rashes appearing 3 to 5 days. And then for prevention, stay away from the measles infected, especially patient zero. Wash your hands, avoid sharing food, utensils, water. If you're the infected, isolate for at least 4 days. Avoid contact with people. Okay, so before 1963, Francis Home explained in 1757 that measles is caused by an infection in the blood of the patients. In 1912, measles became noticeable in the United States, recording 6,000 cases each year. That's pretty significant. 1963, the first vaccine was developed, being composed of mumps and rubella, and or both of them, added with varicella. This was made by John F. Enders and Dr. Thomas C. Pebbles. It's 1978, CDC set a goal to eliminate the disease by 1982. 1981, however, 80% of cases were down in all cases of measles. Uh, However, in 1989, that was interrupted when the goal of the CDC was interrupted due to a massive outbreak of measles in school-age children and also college students, which I'll explain later. Vast improvements were made to the first vaccine, as well as recommending second doses for children to prevent any widespread. 2000, measles was declared eliminated from the United States. There are still minor outbreaks here and there throughout the years. There's actually one recorded in 2018. As you can see right here, with vaccination. With vaccination, the number of cases drop. Without vaccination, you have a steady increase of cases. So who is Dale Morse? The one who headed the second vaccination. Dale Morse is the director of the Bureau of Communicable Disease Control, which is CDC, in the New York Department of Health, and associate professor. And he's an associate professor. Dr. Burkhead, medical director of the immunization program, and Dr. Dale Morse, who we just talked about, headed the expert panel that integrated the two-dose vaccination policy after measles resurfaced in the 1980s. Former associate director for food safety as well, in the division of foodborne, waterborne, and environmental diseases. Dale Morse and his team conducted second doses of MMR vaccine to ensure full prevention of the measles diseases. Other approaches demonstrated by Morse explain how to pinpoint communities that could benefit from these vaccines. Areas with more children, like schools, explain to them the severities of the disease and benefits of vaccination. So, essentially, health literacy programs that educate about measles and its outbreak capabilities. So, again, before 1963, an estimated 3 to 4 million people contracted measles each year. Of these 3 to 4 million, 500,000 reported each year to the CDC. That's about 1 in 10 people being reported. Of these, 4 to 500 died. So that's another tenth of the 500,000 reported. 48,000 were hospitalized, 1,000 developed encephalitis, brain swelling from measles. Implementation of the single dose throughout the 1970s was successful, but it did not produce a viable antibodies to combat wild type measles strain that necessitated the need for a 2-dose vaccination. So when the outbreak happened in 1989, they needed a 2-dose vaccine to counter it, the outbreak. So, as I said, highest risk were college students, uh, particularly pregnant women and preschoolers less than 5 years old. In the fall of 1990, the 2-dose vaccination was finally introduced and became a requirement. Uh, Before that, the infection rate from patient zero alone could infect 12 to 18 people in a fully susceptible population. This is a report from the WHO, World Health Organization. It's actually from 2021. Fortunately, though, measles does not have a genetic factor. Uh, some elimination challenges to the measles vaccine or to the measles virus came from exempt persons, some religious and medical communities. If you had a medical condition, sometimes you couldn't receive the measles vaccine. Also, there's discontinuity of treatments. So someone received a single dose, but not the double dose. So again, time lapse from first to second dose, especially with children. Parents didn't want their kids getting the vaccination because of all the implications. Compromise had to be struck. That is like a firefighting approach. So they couldn't uh, essentially tear out the wiring in the building to prevent a fire, but they could put a system in place to anticipate fires. Unfortunately, catastrophes like COVID really complicated the vaccinations further implementation more recently. Vaccinees that actually did get the vaccination, even to this day, are 1/3 to 1/2 as likely to get measles compared to the single dose recipients. The herd immunity, as defined by different health groups, is about 94%. Second recommendation to combat any further spread in the future is increased surveillance on importation of measles. So, for example, importation of measles from foreign countries to the US, particularly. Here's a graph that shows the number of cases from 2010 to our current time, 2023. So again, you can see in 2018, you had a large spike, and then right before COVID, it dropped, fortunately. Okay. And then lastly, as I was talking about with immunization backslides, during the COVID pandemic, there was a decrease in immunization across the world and the US too. The WHO, the World Health Organization, reported that the number of children receiving the first dose was at 86% in 2019, dropped 5% to 81% in 2021, and increased by 2% in 2022. Unfortunately, 74% of children only got the second dose. To achieve herd immunity, again, this is a different figure from my colleague Capriana. It's about 95%, so 1 percentile more. And the decrease in numbers has caused an increase in concerns for measles outbreaks in the future. So increased surveillance and increased responsiveness definitely will factor in. And here are all of our references. And thank you for listening to my presentation. You have a good day.